Doctor, is it true I'm going to lose my foot? That question, wow, it just cuts right to the heart of it, doesn't it? It's the ultimate fear for so many patients, and it often comes at the end of a long, and I mean long, silent journey.
Hey, welcome to The Explainer. Today, we're going to unpack the story that's hiding behind that terrifying question. We're talking about peripheral arterial disease. And here's the key thing to know right up front. It's a condition where the pain you feel in your legs, well, that's actually a critical warning message from your entire body.
All right, so let's dive in. The story here actually starts years, sometimes even decades, before anyone feels the slightest hint of pain. It all starts with this quiet, kind of sneaky process that's building up inside the body's arteries. Okay, so the main villain in our story? It's called atherosclerosis. And you've got to understand this is not just a leg problem, it's happening everywhere in the body. You can think of it like old plumbing. Plaque, that nasty gunk made of fat, cholesterol, and other stuff, starts building up on the inside of your arteries, all over your body. Over time, it hardens and makes those pathways for blood narrower and narrower.
So what speeds this whole process up? Well, there are a few usual suspects. Sure, getting older and your family history, those play a part. But listen to this, because it's really important. The single most powerful, most damaging, and here's the key, most changeable risk factor is smoking. No contest. It is a massive, massive driver of this disease.
So for a long, long time, nothing. You feel fine. But underneath, those arteries are getting narrower. And eventually, you hit a tipping point. They get so narrow that they just can't get enough oxygen-rich blood to your muscles when you're moving around. And that's when the body finally sends out its first clear, painful warning signal. This classic warning sign has a name, intermittent claudication. And it works like this. You're walking, and you get this predictable cramping pain that literally forces you to stop. So you rest for a few minutes, the pain fades, you think, okay, I'm good. You start walking again, and boom, the pain comes right back. You can imagine how frustrating that cycle is. It just completely puts a limit on what you can do. Now here's something that's actually pretty incredible. Where you feel that pain, it acts like a roadmap for the doctors. Seriously, if the pain is in your calf, the blockage is probably in the big artery in your thigh. If the pain is way up in your thighs or your butt, then the blockage is likely much, much higher up. The location of the pain points a big flashing arrow right at the problem. So the pain gets worse, and that's what finally gets someone into the doctor's office. This is where the detective work really begins. And you know what? It often starts with a simple, hands-on physical exam that can tell a doctor a ton. They're looking for all these little telltale signs of bad blood flow, right? Things like your skin feeling cool, maybe some hair loss on your legs, or the skin looking kind of shiny and thin. But the most powerful clue of all? The pulse. Get this. If a doctor can't feel the two main pulses in your foot, the odds of you having this disease go up by almost 10 times. How crazy is that? Such a simple check, but it's incredibly powerful.
Okay, so to put a real number on it, the next step is usually this quick and totally painless test called the ankle brachial index, or ABI for short. It's a really simple idea. All they do is compare the blood pressure down at your ankle to the blood pressure up in your arm. And it's that final ratio that tells the whole story. See, in a healthy person, the pressure in your arm and ankle should be pretty much the same, so you get a number around 1. But if there's a blockage, the pressure in the ankle drops. A score of 0.90 or less, that confirms it. That's the magic number that says, yep, you have peripheral arterial disease. And the lower that number goes, the worse the blockage is. Now, if this whole thing isn't managed, it can progress to a much, much more dangerous stage. We're not just talking about pain when you walk anymore. We're talking about a situation where the leg and the foot are in serious trouble all the time, even when you're just sitting there. This stage has a very serious name, chronic limb-threatening ischemia, or CLTI. At this point, the blood flow is so bad that the actual tissue starts to die. This can mean constant, agonizing pain, especially at night when you're lying flat. Or it can mean you get little sores or ulcers on your feet that just will not heal. Make no mistake, this is an absolute emergency. The limb is at risk. So the treatment plan has to be aggressive, and it kind of works like a ladder. Step 1 is the foundation. You have to tackle the risk factors. That means quitting smoking, period, getting blood pressure and cholesterol under control, and starting a supervised exercise program. Step 2, you can add some medications to help with the symptoms. But for that really severe stage, CLTI, you have to go to step 3, revascularization.
That means you have to get in there and restore blood flow right now to save the limb.
And there are basically two main ways to do that. The first is the endovascular route. It's minimally invasive. They go in through the artery itself with tiny balloons and stents to prop it open. This works great for shorter, simpler blockages. The other way is open surgery, a bypass. This is more like building a new pipe, a detour around the blockage, usually with one of your own veins or a synthetic tube. It's a bigger deal for sure, but it's often the better, more durable solution for really long or complex blockages.
Okay, and this brings us to what is, without a doubt, the most important takeaway from this whole thing. Because fixing the plumbing in the leg, that's only part of the story. Not even close to the whole story.
So you might be thinking, great, we restored blood flow to the leg, problem solved, right? It's a super common thought, but it's also a really dangerous misconception. The story is nowhere near over.
And this is the absolute heart of the matter, the key takeaway. Peripheral arterial disease is not a leg problem. Let me say that again. It is not a leg problem. That same gunk, that atherosclerosis that's clogging up the arteries in your legs, it's the exact same process happening in the arteries leading to your heart and to your brain.
And because of that, a PAOD diagnosis is a massive red flag. It's a huge predictor of a future heart attack or a stroke. In fact, doctors consider it to be just as risky as if you already had a known blockage in your heart. That pain in your leg, it's a warning siren for your entire body.
Which brings us to a statistic that is just absolutely sobering. 70%. Just let that sink in for a second. 70%. That is the percentage of patients who don't survive for 3 years after having a major amputation because of this disease.
So you see, this was never just about losing a limb. It's about losing a life. The death rate is so incredibly high because of those other events, the heart attacks and strokes. Even if you have a successful procedure that saves the leg, your long-term survival is still a major concern because that underlying disease, that atherosclerosis, it's still everywhere.
So we're left with this one final critical thought. What is the single most important message your legs might be trying to send you? It's this. The pain isn't about walking. It's a direct message from your entire cardiovascular system. And listening to that warning, acting on it, treating the whole person, not just the leg, that's how you save so much more than a limb. That's how you save a life.